All right, you go to the hospital expecting to get the best care, of course, but that's not always the case. It is estimated up to 200,000 patients die in the hospital each year due to preventable medical mistakes. ABC 2's Ashley James takes a look at something called a never event and the recommendations to help keep patients safe.
It's a serious preventable event that should never happen to patients in the hospital.
So you come into the hospital to have your right kidney removed, and the hospital removes your left kidney instead.
Dr. Matt Austin is with the Armstrong Institute for Patient Safety and Quality at Johns Hopkins. Austin says last year in the state of Maryland, there were 227 never events that caused death or serious disability to a patient.
You see these types of events in all types of hospitals, from small community hospitals up to large academic medical centers.
In Maryland, numbers are collected, but the hospital itself is not listed.
We don't necessarily know hospital by hospital numbers, but we know how many events occurred in all the hospitals.
Austin says the state of Minnesota is really a model of how information can be reported.
They actually publicly report the number of events by hospital, the type of event, and whether the event resulted in a patient death or a serious disability to the patient.
Johns Hopkins safety experts, including Austin, are calling for changes in policy to reduce these preventable events, including standard definitions of a never event, a call for public reporting and more transparency, and how to use this information in a systematic way to understand where the problems are to reduce these events. Austin says patients and families should also take steps to help improve their overall experience.
Share what your expectations are, share what your preferences are, speak up if something doesn't seem quite right.
For ABC 2 News, I'm Ashley James.